Okay, let's go.
Hello? I need a pharmacist and a nurse to the consultation room right now. There's something that we need to discuss. But also, if possibly, can you also call the CFO? Thank you.
Hello?
Ayo, right now.
Oh, okay, doctor. I will be there in 5 minutes.
Oh, okay, doctor. Wait for me, yes?
Okay, come. Wait. Assalamualaikum and good day, everyone. It's quite a heavy duty day today, but it's fine. I'd like to know which doctor told me to this consultation room. You are. Okay, it's okay. Please continue explain about the patient and overall. After that, continue with the pharmacist and the senior nurse, our system here. Please, doctor.
Greetings to you, CFO. I'm the doctor who called everyone today. My name is Nur Bahira. So today, I would like to present a case of a 68-year-old female patient who has been experiencing persistent sneezing, a runny nose, nasal itching, and nasal congestion for the past few weeks. Unfortunately, her symptoms are worse in the early morning and particularly during hospitaling. Based on the symptom pattern and the exposure history, my diagnosis is allergic rhinitis and IgE-mediated inflammatory condition that caused by allergen exposure, which I suspect from the dust from home, that leading to histamine release and typical nasal symptoms.
That sounds uncomfortable for the patient, doctor. But what are the treatment options you are considering for her?
Allergic rhinitis is associated with a group of symptoms affecting the nose. These symptoms occur when you are breathed in something you are allergic to, such as dust, animal dander, or pollen. Symptoms can occur when you eat a food that you are allergic to. While for nasal congestion, it is a hallmark symptom for allergic rhinitis. It directly caused by the body's inflammatory response to allergens like pollen or dust mites, which swells nasal passages and blocks airflow, leading to stuffiness, sneezing, and often poor sleep. This inflammation involves immune cells and chemical mediators, constricting nasal passages and causing fluid buildup, making it hard to breathe. In this case, our Dr. Bah prescribed the patient with fexofenadine 180 mg and azelastine 0.1%.
We are focusing on managing the nasal symptom without causing what side effect that could make things worsen for the patient. So I will ensure it is monitored for any possible side effects. What about you, doctor?
I agree that intranasal therapy may be beneficial, especially if the nasal congestion is quite prominent. Moreover, this medication acts directly at the site of inflammation and can provide better symptom control while reducing systemic exposure. The combination therapy with a decongestion might provide faster relief, but we also must be cautious because decongestion can also cause palpitation, dizziness, and even elevated blood pressure. Hence, these side effects could also increase the risk of fall, which is something that we really need to avoid at the age. So, any perspective on that?
That's a very good point, Dr. Bah. The combination therapy could be considered for a short-term use only. But for a long-term use, I consider patient need to be used monotherapy fexofenadine for her entire life. So how about it? Understood. Pharmacist, I will keep a close watch on her response to the medication, and I will ensure she is comfortable and that we are not seeing any adverse effect on her.
Okay, please do so.
Alright, right now, I will explain about the drug profile of fexofenadine and azelastine. For fexofenadine, the mechanism of action is, it is a second-generation oral antihistamine that blocks the action of histamine at the H1 receptor to reduce allergy symptoms such as sneezing, itching, and watery eyes. For azelastine, It is an intranasal antihistamine that directly blocks histamine receptors in the nasal passages, helping to reduce congestion, sneezing, and itching in the nasal cavity. The clinical use of fexofenadine is it will be taken orally, which provides systemic relief for a range of allergy symptoms, including those affecting the skin and eyes. While for azelastine, it delivered as a nasal spray. It provides localized relief for nasal congestion and other allergic rhinitis symptoms. The onset of action of fexofenadine is typically within 1 hour, but the duration is 12 to 24 hours depending on the dosage. The safety is generally well tolerated with fewer sedative effects than first-generation antihistamines. While azelastine, the onset of action is often provides relief within 15 minutes. The duration typically 12 hours per dose, and the safety is the local side effects like nasal irritation may occur. Minimal systemic absorption reduce side effects. The dosage, form, and administration of fexofenadine. It is oral tablets, 60 mg twice a day or 180 mg once daily. While azelastine, the dosage, form, and administration. It is a nasal spray. The patient needs to take 1 to 2 sprays in each nostril twice daily. The common side effects of fexofenadine are headache, drowsiness, dizziness, and nausea. While azelastine, nasal irritation or dryness, bitter taste, headache, and drowsiness.
So, CFO, what about you?
Alright, there's a good discussion here. Thanks a lot to our professionals, our Dr. Ba, our pharmacist, Najwa, and our sister, our senior nurse, which is Dia. Am I correct?
Yes.
Okay. I don't have a lot of knowledge about medicines yet. I'm responsible to monitor the cost effectiveness of the drugs prescribed by the Dr. Ba for hospital and the patient sites. Okay. That's my job to find out the best brand suitable for those medication mentioned, which are fexofenadine by the Dr. Ba and azelastine by our pharmacist Najwa. Doctor, need to let me know about this. How long should the patient continue using azelastine and also the fexofenadine? I'm sorry. About those two medications. Or how long should the patient continue using those medications? After the consultation of the patient resident. Okay. Also, pharmacists need to correctly double check the dose required for both medications. We don't want to any dangerous thing happen, like overdose or lower dose by you guys, our professionals. If it is required by the doctor for the patient to continue this medication in future where necessary, we need to consider cost of the medication of the patient to buy at normal pharmacy over the counter later on. Okay, so now there's anything I need to know? I need to go?
There's nothing left anymore, but after hearing from every side, every opinion, so I think I will conclude that we will proceed with fexofenadine and then azelastine for nasal congestion with monitoring if there is any side effect occur to the patient.
Alright. If you guys have any update later on, please contact me or just WhatsApp me. I would like to know every single thing. Okay, thank you everyone.
Okay, thank you. Thank you, doctor, for your cooperation. This bucket.
So, I will make sure to order azelastine and ensure in stock for the patient use.
And I will prepare the medication and educate the patient on proper usage, especially about the nasal spray.
Alright, now let's see the comparison between fexofenadine and azelastine. For the onset, azelastine works quicker because it's applied directly to the nasal tissues. Many guidelines note relief within 15 to 30 minutes for intranasal antihistamine, while fexofenadine takes slightly longer, up to 1 hour, as it needs to be absorbed systemically. For safety, in elderly, most are newer second-generation antihistamine with better safety than older antihistamine, the first generation. Fexofenadine has very low sedation and few systemic side effects, while azelastine is localized with fewer systemic side effects but needs cautious use if the elderly have other illness. For the cost and availability in Malaysia, the oral antihistamines like fexofenadine are commonly stocked and cheaper due to generic options, while intranasal azelastine may be pricier and less widely available than oral antihistamines.
Hi, Lily. How about your condition right now?
No, nurse, my nose is really congested and my allergies doesn't seem to be improving. How can you help me?
Well, after I discussed with our professionals, Dr. Bahira already prescribed me with your medication, which is azelastine and fexofenadine. Well, for your fexofenadine, it is tablet. So you need to swallow 120 mg tablet while wash daily with a full glass of water. Prefer before a meal or an empty stomach. You also need to avoid high-fat mixed fruit juice like grapefruit, orange, and apple because they can reduce its effective acid. So, and if you need to stop face of anything, do not stop it. We will monitor you closely. You also need to consult your pharmacist if you have any problem. Okay? Okay, thank you for your cooperation, Miss.
Thank you for having me too. Bye.
Bye.
We have learned that patient-centered care ensures better outcomes by tailoring treatments to individual needs, and as pharmacy personnel, being honest, ethical, and fair is essential to building trust and providing the best care that we can give.
This case taught me that patient-centered care, guided by honesty, ethics, and fairness, is essential to ensure patient safety, trust, and effective treatment outcomes.
From the case, the key value I learned is interprofessional collaboration between healthcare team for holistic care. Patient-centered care matters because it places the patient its unique needs, preference, and safety first, leading to better health outcomes. Pharmacy personnel should be honest, ethical, and fair to safeguard patient safety by accurately verifying doses and information.
The key value that I learned is pharmacy personnel must be honest, ethical, and fair to maintain trust, ensure safe medication use, and protect patient well-being.